The phone call came just after sunrise. A daughter had spent the entire night wondering why her mother's voice sounded so different. The evening before, everything seemed ordinary. A quick conversation, a few laughs, a promise to visit over the weekend. But less than 12 hours later, the nursing home staff said her mother was being taken to the hospital after suddenly becoming seriously ill. The family couldn't understand how things had changed so quickly. When they arrived, they began asking questions that many families ask after a medical emergency. Had anyone noticed the warning signs? When did the symptoms begin? Were the nurses informed? Was a doctor contacted? Were those concerns written down in the medical record? The answers weren't as clear as they expected. Stories like this raise an important legal question in the United States. At what point does a nursing home become legally responsible for ignoring symptoms? Is every bad medical outcome considered negligence? Or are there specific legal standards that separate an unfortunate event from a failure to provide reasonable care? Today, we're going to walk through a realistic scenario inspired by the kinds of concerns families often face. While the characters and events in this story are fictional, the legal principles we'll discuss are based on how nursing home negligence cases are generally evaluated in the United States. This video is for educational purposes only and is not legal advice. Our story begins in early spring at Maple Grove Care Center, a long-term care facility located in a quiet suburban community outside Columbus, Ohio. 81-year-old Eleanor Brooks had lived there for nearly 2 years after a series of falls made it unsafe for her to live alone. She still enjoyed reading mystery novels, talking with her daughter every evening, and joining the afternoon activities whenever she felt well. Although she had high blood pressure and diabetes, her conditions had remained relatively stable for months. Then small changes began to appear. One morning, Eleanor skipped breakfast because she said she wasn't hungry. Later that afternoon, a nursing assistant noticed she looked unusually tired. During dinner, she barely touched her food and quietly mentioned that her stomach didn't feel right. None of these symptoms, standing alone, necessarily pointed to a medical emergency. Older adults can have good days and bad days, and nursing home staff often care for residents with complex medical needs. But the next day, another staff member noticed that Eleanor seemed more confused than usual. She asked the same question several times within a few minutes. She complained of chills even though the room was warm. According to one employee, she also appeared weaker while walking back from the dining area. At this stage, it's important to separate facts from legal conclusions. A resident becoming tired or confused does not automatically mean a nursing home has done something wrong. The law does not require caregivers to predict every illness before it happens. Instead, the question is whether reasonable staff members recognized concerning changes, followed facility policies, communicated with medical providers, and responded appropriately under the circumstances. That distinction is what makes these cases so difficult. Families often focus on the final outcome, while courts examine the decisions that were made before the emergency occurred. Every observation, every phone call, every chart entry, and every delay can become part of the timeline. Sometimes the records show that staff acted quickly and responsibly. Other times, the timeline raises questions that deserve a much closer look. As Eleanor's condition continued to change over the next 24 hours, the documentation and the decisions made by the people responsible for her care would become the center of everything that followed. By the following morning, Eleanor's condition had changed in ways that her daughter had never seen before. During their usual phone call, Eleanor struggled to stay focused. She paused in the middle of sentences, repeated herself several times, and sounded unusually weak. When her daughter asked if everything was okay, Eleanor simply replied, "I'm just tired. Maybe I'm getting older." For many families, that's exactly where the uncertainty begins. Fatigue, poor appetite, mild confusion, and stomach discomfort are symptoms that can have dozens of different causes in older adults. Sometimes they're linked to dehydration. Sometimes they're caused by an infection, a medication side effect, or an underlying medical condition. And sometimes they truly are temporary. The challenge is that these early warning signs often look small until they're viewed together. Later that afternoon, another caregiver noticed Eleanor wasn't interested in lunch. She drank only a few sips of water before pushing the tray away. When asked how she felt, she quietly mentioned feeling cold, even though the room temperature was comfortable. Her skin appeared pale, and she seemed less energetic than she had been just 2 days earlier. By themselves, none of these observations prove that a medical emergency is developing. That's an important point. Good healthcare depends on recognizing patterns rather than jumping to conclusions after a single symptom. This is where careful monitoring becomes so important in long-term care settings. Nursing home staff are expected to observe residents throughout the day, document meaningful changes, and communicate concerns through the facility's established procedures. Those procedures vary from one facility to another, but the overall goal is the same. Identify significant changes early enough for appropriate medical evaluation. That doesn't mean every resident with fatigue or stomach discomfort needs to be rushed to the emergency room. It does mean that when several concerning changes appear together, or when symptoms continue getting worse, they deserve careful attention rather than being dismissed as a normal part of aging. As the afternoon turned into evening, Eleanor developed loose stools and complained that her stomach felt unsettled. She also appeared more confused than earlier in the day. A staff member recorded the change, encouraged fluids, and continued routine monitoring while waiting for the next nursing assessment. At this point, it's worth pausing the story for a moment. One of the biggest misconceptions about aging is that new symptoms are simply something older adults have to accept. In reality, healthcare professionals are trained to evaluate changes from a person's normal baseline. If someone who is usually alert suddenly becomes confused, or someone who normally eats well suddenly loses their appetite, those changes deserve attention because they may signal an underlying medical problem. The cause could be something relatively minor, or it could be the beginning of a more serious illness. The symptoms alone don't provide the answer. They simply tell us that further evaluation may be appropriate. As evening approached, Eleanor's temperature rose slightly. It wasn't dramatically high, but it was different from her usual readings. Combined with her fatigue, poor appetite, stomach complaints, and increasing confusion, the picture was becoming more concerning. Again, it's impossible to diagnose the cause based on symptoms alone. Several different medical conditions could produce a similar pattern. That's exactly why timely clinical assessment matters. For families watching from the outside, situations like this can be frustrating. Loved ones often notice subtle changes during phone calls or visits, yet they don't always know what questions to ask. A simple conversation can make a difference. Asking whether new symptoms have been documented, whether the primary healthcare provider has been notified, and what monitoring plan is in place can help families better understand what's happening. Good communication benefits everyone. It keeps families informed, helps healthcare teams compare observations, and creates a clearer picture of how a resident's condition is changing over time. As the night continued, Eleanor became increasingly restless. She slept only briefly, complained of abdominal discomfort, and seemed weaker when staff helped her move from her bed to a chair. The next few hours would become the turning point in her story, not because anyone yet knew the exact cause of her illness, but because the decisions made during this period would later shape the questions everyone would ask after she was rushed to the hospital. She also wanted to understand whether the warning signs had been recognized early enough, and whether anything could have been done differently before the emergency ever happened. Shortly before dawn, Eleanor's condition took another turn. A nursing assistant helping residents begin their morning routine noticed that Eleanor was much harder to wake than usual. When she finally opened her eyes, she appeared disoriented. She answered simple questions slowly and seemed too weak to sit up without assistance. Her breathing was a little faster than normal, and she said she felt completely exhausted. The charge nurse immediately performed a new assessment. Eleanor's vital signs showed several changes compared with previous recordings, and her overall condition no longer matched her normal baseline. Following the facility's emergency procedures, the nurse contacted the on-call medical provider, who recommended immediate transfer to the nearest hospital for further evaluation. Within minutes, paramedics arrived. For Eleanor's daughter, the phone call was both frightening and confusing. The evening before, she had been told her mother simply wasn't feeling well. Now she was on her way to the emergency department without knowing exactly what had happened overnight. At the hospital, doctors began a systematic evaluation rather than assuming a single cause. Blood tests were ordered, urine samples were collected, imaging studies were considered. Because Eleanor had experienced persistent digestive symptoms, along with weakness and changes in mental status, the medical team also discussed whether additional gastrointestinal testing might be appropriate. This is an important point to understand. Many illnesses can cause fatigue, confusion, poor appetite, and digestive problems in older adults. Dehydration, urinary tract infections, medication reactions, viral illnesses, bacterial infections, metabolic disorders, and gastrointestinal conditions can all produce similar symptoms. Healthcare providers usually work through a process of eliminating possibilities instead of jumping to one conclusion based on a few symptoms. That careful approach helps reduce the risk of both missed diagnoses and unnecessary treatment. As Eleanor's daughter spoke with the emergency physician, she mentioned something she hadn't thought was important before. During several recent visits, her mother had occasionally complained of abdominal discomfort, intermittent diarrhea, and unexplained itching. None of those symptoms had seemed severe by themselves, but together they gave the physician a broader picture of what had been happening over the previous several weeks. The doctor explained that when symptoms persist or follow an unusual pattern, additional testing may sometimes be appropriate. Depending on the person's history, travel, exposures, medications, and overall health, different laboratory studies may be considered. One possible test in certain situations is a stool examination designed to look for parasites or other causes of ongoing digestive illness. It's important to emphasize that these tests are not ordered for every patient with stomach discomfort. They are requested when the clinical picture suggests they may provide useful information. The decision depends on the individual's symptoms, medical history, and the healthcare provider's professional judgment. Over the next 2 days, Eleanor remained in the hospital while doctors continued their evaluation. She received supportive care, including fluids and treatment directed at the problems identified during her assessment. As additional laboratory results became available, the medical team was able to better understand what had been contributing to her illness. One finding stood out. A specialized stool test identified evidence of an intestinal parasite that had likely been present for some time. Combined with dehydration and nutritional deficiencies, the infection had gradually weakened her body until the symptoms became impossible to ignore. The diagnosis surprised Eleanor's family. Like many people, they assumed intestinal parasites were extremely rare in the United States. In reality, while they are less common than many other digestive illnesses, they can still occur. Certain parasites are associated with contaminated food or water, close contact settings, travel, or other specific exposures. The appropriate treatment depends entirely on identifying the specific organism involved. The infectious disease specialist reassured the family that the most important step was obtaining an accurate diagnosis. Once the cause was identified, a treatment plan could be tailored to Eleanor's condition instead of relying on guesswork. But as Eleanor slowly began to recover, another conversation started to emerge. Her daughter wasn't only asking what had made her mother sick. As Eleanor's condition gradually improved, her daughter found herself thinking less about the diagnosis and more about the days leading up to it. She wasn't looking for someone to blame. She simply wanted to understand whether the illness had been recognized as early as it reasonably could have been. She requested copies of her mother's medical records from both the hospital and the nursing home. Like many families, she assumed the records would provide a straightforward timeline. Instead, they raised new questions. The nursing notes documented that Eleanor had experienced fatigue, a reduced appetite, and episodes of stomach discomfort over several days. One entry mentioned that she appeared more confused than usual. Another noted loose stools and increasing weakness. The records also showed when her vital signs were taken, when staff notified the supervising nurse, and when the decision was made to transfer her to the hospital. At first glance, the documentation seemed complete, but medical records don't automatically answer the most important question. Were the actions taken appropriate based on the information available at the time? That's where context matters. Healthcare professionals are expected to use their clinical judgment when evaluating changes in a resident's condition. Not every symptom requires emergency treatment, and not every illness can be identified during its earliest stage. Medicine often involves uncertainty, especially when caring for older adults whose symptoms may develop gradually or appear differently than they do in younger patients. However, when several warning signs begin to appear together, healthcare teams are generally expected to reassess the situation, communicate with the appropriate medical provider, and adjust the care plan as needed. In Eleanor's case, the timeline showed that her symptoms didn't appear all at once. They developed over several days. That gradual progression made the situation more challenging, but it also created opportunities to observe whether her condition was improving, remaining stable, or becoming worse. This is one reason documentation is so important in long-term care. Accurate charting helps ensure that each member of the healthcare team understands what has changed since the previous shift. It allows nurses, physicians, and other providers to recognize patterns that might not be obvious from a single observation. It also helps families understand the sequence of events if questions arise later. Poor documentation doesn't necessarily mean poor care occurred. Likewise, detailed documentation doesn't automatically prove that every decision was correct. The records are one part of a much larger picture. Eleanor's daughter also scheduled a meeting with the facility's administrator and director of nursing. Rather than making accusations, she asked practical questions. What symptoms had staff observed before her mother was sent to the hospital? When was the physician first notified? Were there any changes in her care plan? Had similar symptoms occurred before? The meeting was respectful, but it highlighted something many families experience. Clear communication can reduce confusion, build trust, and answer important questions before misunderstandings develop. When communication is limited, families are often left trying to piece together events after a crisis has already occurred. It's also important to recognize that nursing homes care for residents with many different medical conditions, and staff members must prioritize multiple responsibilities throughout the day. The legal and professional expectation is not perfection. Instead, the expectation is that residents receive care that meets the accepted standard for the circumstances, with reasonable monitoring, timely communication, and appropriate medical follow-up when significant changes occur. For viewers with loved ones in long-term care, there are several practical lessons from Eleanor's story. Stay involved in routine conversations about your family member's health. Ask about changes in appetite, energy level, bowel habits, confusion, or new discomfort. If something seems different from their usual baseline, don't hesitate to ask how the healthcare team is evaluating those changes. Most importantly, remember that families are valuable partners in care. They often notice subtle differences that may not be immediately obvious during a busy shift. Sharing those observations respectfully can help healthcare providers build a more complete understanding of a resident's condition. As Eleanor prepared to leave the hospital, one question still remained unanswered. If her symptoms had been recognized and investigated earlier, would the outcome have been different? It's a difficult question, and one that medicine and sometimes the legal system cannot always answer with certainty. When Eleanor was discharged from the hospital, she looked noticeably better than she had just a week earlier. Her appetite had started to return, she was able to walk short distances with assistance, and her energy improved a little each day. Recovery wasn't immediate, but there was finally a clear treatment plan and a better understanding of what had caused her condition to decline. For her daughter, however, the experience had changed the way she viewed long-term care. She realized that being involved in a loved one's healthcare doesn't mean questioning every decision. It means staying informed, asking respectful questions, and making sure important changes don't go unnoticed. One of the most valuable lessons from Eleanor's experience is that older adults often develop illnesses differently than younger people. A serious medical condition may begin with subtle signs such as reduced appetite, unusual fatigue, mild confusion, or a gradual loss of energy rather than dramatic symptoms. Because these changes can easily be mistaken for normal aging, they deserve careful attention when they appear suddenly or continue to worsen. That doesn't mean every change signals a medical emergency. Many common conditions can produce similar symptoms, and only a qualified healthcare professional can determine the underlying cause through a proper evaluation. Families can play an important role by knowing their loved one's normal baseline. If someone who usually enjoys meals suddenly refuses food for several days, becomes unusually sleepy, or seems confused without an obvious explanation, those observations are worth sharing with the healthcare team. Small details that seem unimportant on their own can become meaningful when viewed together. It's also helpful to ask how the facility is monitoring new symptoms. Questions like, "Has the nurse evaluated this change?" or "Has the healthcare provider been notified?" Encourage open communication without assuming that something has been done incorrectly. Another important lesson involves medical testing. No single laboratory test can diagnose every digestive illness. The appropriate evaluation depends on a person's symptoms, medical history, medications, travel history, possible exposures, and physical examination. In some situations, healthcare providers may recommend blood work. In others, imaging studies or stool testing may be more appropriate. The right approach is individualized, rather than one size fits all. If symptoms continue despite treatment, it's reasonable for patients and families to ask whether additional evaluation or referral to a specialist should be considered. Seeking a second opinion is a normal part of healthcare and can provide reassurance or identify options that may not have been discussed previously. Nutrition and hydration also deserve special attention in older adults recovering from gastrointestinal illness. Persistent diarrhea, vomiting, or poor appetite can increase the risk of dehydration and nutritional deficiencies. Following the care plan provided by healthcare professionals, including prescribed medications, dietary recommendations, and follow-up appointments, can support recovery and reduce the chance of complications. Some people wonder whether natural foods or supplements can replace medical treatment for intestinal parasites or other infections. Current scientific evidence does not support using home remedies as a substitute for treatments prescribed by a qualified healthcare provider. While foods such as garlic, ginger, or pumpkin seeds are nutritious and may fit into a healthy diet, they should not be viewed as proven cures for parasitic infections. Anyone with persistent digestive symptoms should seek appropriate medical evaluation instead of relying on self-treatment. Perhaps the biggest takeaway from Eleanor's story is that paying attention to patterns matters. One isolated symptom may not mean very much, but when several new changes appear together, or when symptoms continue getting worse, they deserve a conversation with a healthcare professional. Early recognition doesn't guarantee that every illness can be prevented, but it can improve the chances of receiving timely evaluation and appropriate treatment. As Eleanor settled back into her daily routine, she was grateful for another opportunity to enjoy simple moments with her family. Her daughter still visited every weekend, but now those visits included more conversations with the care team and a better understanding of how important communication can be in protecting the health of older adults. Sometimes the most powerful form of advocacy begins with a simple question asked at the right time. Has anything changed since yesterday? That one question can open the door to better communication, earlier evaluation, and in some cases, better outcomes. Several months later, Eleanor's life had settled back into a comfortable routine. She was once again spending afternoons with her favorite mystery novels, joining social activities when she felt up to it, and looking forward to her daughter's weekend visits. Although she still needed the daily support that the nursing home provided, she had regained much of the strength she had lost during her illness. Looking back, her daughter realized that the biggest lesson wasn't about a single diagnosis. It was about paying attention to gradual changes that might otherwise be dismissed. None of Eleanor's early symptoms seemed dramatic on their own. A smaller appetite, more fatigue than usual, mild stomach discomfort, moments of confusion. Taken separately, each could have had many different explanations. Together, they formed a pattern that eventually required medical evaluation. That idea applies far beyond this fictional story. Many health conditions affecting older adults develop slowly. Infections, nutritional deficiencies, medication side effects, digestive disorders, dehydration, and many other illnesses can begin with subtle changes rather than obvious emergencies. Recognizing those changes early gives healthcare professionals the opportunity to investigate before the situation becomes more serious. It's also important to remember that symptoms alone cannot tell us what condition a person has. Fatigue does not automatically mean anemia. Stomach discomfort does not automatically mean a parasite. Confusion does not automatically indicate dementia. These symptoms overlap with many different medical conditions, which is why a proper evaluation by a qualified healthcare provider is so important. For families with loved ones living in nursing homes or assisted living communities, staying engaged can make a meaningful difference. Keep a simple record of changes you notice during visits or phone calls. If your family member seems unusually tired, stops enjoying meals, develops new digestive symptoms, or behaves differently than normal, share those observations with the healthcare team. Families often notice small changes over time that may help complete the clinical picture. At the same time, it's equally important to work together with healthcare professionals rather than assuming the worst. Most nurses, caregivers, physicians, and support staff are committed to providing compassionate care under challenging circumstances. Open communication, respectful questions, and shared decision-making usually lead to the best outcomes for everyone involved. If symptoms persist despite treatment, or if they continue to worsen without a clear explanation, it's reasonable to ask whether additional evaluation or referral to a specialist is appropriate. Seeking clarification or a second medical opinion is a normal part of healthcare and can help patients and families better understand the options available. You may also hear claims online that certain foods, herbs, or supplements can completely eliminate intestinal parasites or cure complex digestive problems. While many nutritious foods can support overall health as part of a balanced diet, they should never replace evidence-based medical care for a suspected infection or other serious condition. The safest approach is to follow the treatment plan recommended by your healthcare provider while discussing any supplements or dietary changes before adding them to your routine. The goal of this story was never to create fear about nursing homes or convince viewers that every overlooked symptom is the result of negligence. Instead, it's a reminder that good health often depends on noticing changes early, communicating clearly, and asking thoughtful questions when something doesn't seem right. If there's one message to remember from Eleanor's journey, it's this: know your loved one's normal baseline. When several new symptoms appear together or a gradual decline continues without improvement, don't assume it's simply a normal part of aging. Bring those concerns to a qualified healthcare professional so they can determine whether further evaluation is needed. Thank you for spending this time with us. We hope this story has encouraged you to become a more informed advocate for your own health or the health of someone you love. If you found this discussion helpful, consider sharing it with a friend or family member who cares for an older adult. Awareness, communication, and timely medical attention can make an important difference, and sometimes the conversation you start today may help protect someone's health tomorrow.